It seems I'm extremely short in time. It's meaning that humans not able to compete with machines still and keep in time scale. If you know today's worldwide day of mental health, and we're going to speak about how digital technologies can help to face and help to, face with these challenges and how digital technology can improve mental health area. So before that, I just wanted to remind you that actually mental health are the most prevalent medical conditions. Every second person, according to new data, will have some mental health issues. As you can see here, so there's not any ages protected from mental health. So it started very early from ADHD, autism, intelligence problems, and then go on with anxiety, depression, sleeping disorder, and our end is dementia or cognitive dysfunctions, which is unfortunately also increasing in their numbers. So we also know that mental health disorders are the most burden conditions. So the most cost in medicine we pay for mental health, for depression, for anxiety, for other mental health issues. So it's very costly, very burden, and for example, depression is the most disabling condition. We probably never thought about this, but the people with depression using disability or or lacking their job as at the high rate as compared with any other medical conditions or any other reasons. So how current mental health care support people with mental health issues or with mental health problems or dealing with these problems? Unfortunately, very badly. If you would like to make an appointment to psychiatrists or to clinicians, psychologists, so you need to wait up to 4 or 5 months before you get appointment. So this waiting list, for example, in UK, 120,000 people are hiding on the hidden waiting list, meaning that they never get support because they're still waiting for many, many months or years. Psychiatrists, mental health professionals still use a very old-fashioned approach when they're dealing with mental health, when they're just supporting people with mental health, which is not very effective. We're making mistakes, wrong diagnosis, wrong treatment decisions, wrong outcomes. And communication. If you'd like to speak to your doctor, you probably may know that it's quite complicated, isn't it? Doctor is not available, you just call in, nobody answering, you write in emails, nobody answering, so it's also making outcome very worse. People stop and taking medication, what they need to take, because they're not getting information at the right time. So the question is how digital technologies can improve the situation, how digital technologies can improve access to support, how can improve efficacy of mental health assessment and treatment, and how may improve communication between patients, between clients, and healthcare providers. I'll believe that actually digital technology is very promising. First of all, for example, e-triage systems based on AI technologies can improve early identification of first sign of mental health issues, depression, dementia, autism, ADHD at very early stage through AI e-triage systems, which may also, just direct patients to right healthcare providers. You don't want to see patients, as patients, we don't want to see doctor who is not able to support you. It's very often happening in mental health. You just meeting some doctor, GP doctor, and GP doctor saying, so it's not my area, go to psychologist speaking to you months, 2, 3, and then saying, you need to go to psychiatrist. So this is like that cycle. So e-triage system can identify problem and direct to right healthcare providers. Digital technology also can improve clinical workflow of professionals. So it may improve our job. It may support us in terms of making decisions, in terms of assessing mental health issues, or in terms of treatment plan. And the last thing, what we believe, chatbots, very popular topic. So AI-based chatbot technologies may improve communication between people and clients. So the first solution, what I would like to present, what you probably some of you definitely using like e-meetings or online meetings. So telemedicine. You can see here topic, stating why telemental didn't make revolution in mental health area. This topic was very popular before COVID. What happened after COVID? We know that all support moved to telemedicine. So we're starting to use telemedicine, and you can see here, yes, it's fortunately, as compared to any other medical areas, we still using telemedicine in mental health. Why is it? I will tell you later, but it's just one picture demonstrating you how many telemedicine clinics or clinics using telemedicine technology in United States after COVID time. So it's just enormous, just huge number of clinics trusting telemedicine, using telemedicine for mental health assessment, because telemedicine really just helping to improve access. And if you're asking me, is it comparable with face-to-face assessment? Absolutely. There is not any difference between assessment done through telemedicine or if you come into your doctor into cabinet. So there's not any difference for any mental health disorders, for any ages. Moreover, telemedicine may improve our assessment, our decisions. How? Camera. So we're using camera, and through camera, using AI technology, we can recognize your emotions, your feeling, your movements much clearer and more precisely than I can do. Because my opinion probably biased by my thoughts, by my mind. I'm distracted when you're speaking to you. But machine never distracted. So it's follow you, it's assessing you probably more precisely. So telemedicine is, in these terms, very, very promising. Digital solutions, another area which may improve assessment and recognition and identification of mental health issues. How it's working in reality, in your pockets, in your hands. You have iPhones, iWatch, all of them technologies, all of them devices collecting data. You're even not thinking about this, but this data collecting about how often you're using smartphone, how you're moving, how often you're using screens, what you're doing, how active you are, how well you're sleeping. So all this data actually collected passively. You're not thinking about this. But all of this data can tell us about your mental health status, about your mental health wellness. So it's quite promising, quite interesting. The problem is, we believe that passive assessment and passive digital phenotyping tools through these technologies can really be linked to some diagnosis, like to anxiety, to stress, to depression. But again, if you're using AI technologies based on this data collected by smartphones, these data quite, still not very straightforward. So because they're not able to predict what happened to you, or not able to predict precisely what will happen to you, whether or not you're suicidal, whether you're not, dangerous to yourself, to other people. So it's still quite unclear when we're using this phenotyping data, passive phenotyping data. Another approach would be collect data actively. So you're sitting in your phone, and then you get from doctor request. Can you please complete some questionnaire? 5, 4, 10 questions to be completed. So when we're completing this data, when we're collecting this data, again, AI technology can just make decision what is happening to you, how you're doing, how you're feeling. Actually, probably in your life, at least you completed some scales, mental health scales or clinical, psychological scales on the paper. Now we can digitalize, and you can see here how funny or how interested manufacturers, developing different types of self-assessment. So it's really something like preference, what you prefer to use. But the problem is, I see a lot of young people sitting in front, what is making me happy, because usually young people having social phobia and sitting outside or just in the back. And people like you using smartphones much more than my generation. So you probably burn with iPhones or with Androids. Well, the problem is, if you're asking or if you're making available apps for digital mental health, you start to download, probably more, but you're not using this. You're using apps for mental health exactly as old people doing or elderly people doing. Probably elderly people even more interested in mental health apps. Why? Because dementia is coming. It's already there. So they would like to, just be aware that actually they still understanding who they are and where they are. But young people are not bothered about this, so they're not using apps for digital health. Why? Probably not trusting. So this was problem 10 years ago. The people didn't understand why I need to collect data, why I need to answer these questions, why doctor asking these questions through apps or somebody asking these questions through apps. Who is owner of this data? What they doing with the data? Probably they selling this data, making advertising or something else. So the people was not trusting apps for mental health. But now the problem is resolved because GDPR, because manufacturers much more clear in terms of disclosure, who is keeping this data, why they're using this data, and data protection definitely is very helpful. The other field, we believe that only apps for people with mental health issues or for population is not really very successful or helpful if these apps not connected to apps for clinicians, for doctor environment. This is my second part, clinical decision support system for clinicians, for professionals. Because my job still is, my job is not without digital. My job is full on digital tools, but my job 10 years ago was on the paper-based. It was really a nightmare. Why? Because we don't have any biomarkers for diagnosing any mental health disorders. If you come into a GP doctor and saying, I have heart problem, they're doing ECG and saying, yeah, you have problems. You have another problems like, epilepsy. So they can be discovered and you can be investigated and they will find biomarkers, electronic bioactivity biomarkers, which really confirm the diagnosis. In psychiatry, how we making decision, how we making diagnosis, do you know? Just observing you, just talking to you. Believe me, I was observing you 5 minutes. It's enough for me to make some clinical decisions. So I already have understanding, okay, what the people may have, but sometimes very wrong decision. But this is what is happening in mental health. Professionals doing assessment and doing decision during 5 minutes based on conversations. We don't have any instruments. We don't have biomarkers helping us. And this pathway to make decisions is very comprehensive. And moreover, our job is very complicated. We're all making money. Even in public or private hospitals, we're making monies. We're making tasks for administration. Administration's very, supportive, very just above of us and just asking, you need to have patients like 10, 20, 30 patients per day. We're not thinking about quality. We're thinking about tasks we need to do. And all these tasks can be improved by electronic healthcare record systems, but this is disaster. Can you recognize anything here? And this is what we need to use when we meet you. We need to complete all these fields. Even we don't understand why these manufacturers who develop HR system requesting from us to complete all these fields, which is not helpful to me, which is not making my job easier, which is not improving my understanding about you. I make some survey across Europe countries, asking my colleagues in different countries, how are you feeling, how digital technology, what you're using, are they helpful for you? They said, no, this is just bullshit, this is just nightmare, so we don't want to use this because they're not produced, they're not developed by people, by psychiatrists who understand the needs of psychiatrists or mental health professionals well. And this is what actually is done by our company, we believe, Documental. So you can just Google our clinic. If you need support, you can get support from our clinic fully based on digital technologies, which is started very smartly from e-triage system app, helping to identify mental health problems at early stage, which making also decision who is the best healthcare providers for you. psychologists, GP doctors or psychiatrists. And when psychiatrists or psychologists, GP doctors meeting you, probably not in cabinet, probably just through telemedicine, they're supported by clinical decision support system, which is making decisions based on AI technologies, on learning machine, but professionals still making decisions, final decisions. They're supported by technologies, but they're not replaced by technologies. And if you ask me, would be psychiatrists ever replaced by machine? I would say probably not. It's so far. I mean, tractor driver, they can be replaced, probably, but not psychiatrists. And after visit, we developing digital phenotyping tools which helping to keep you informed about how you're doing, supporting you when I, as doctor, not available. So we'll speak to chatbot technology, and some people are very happy with this. They're not saying, I would like preferred human. If you have option, get support right now, or waiting for my reply 2 or 3 weeks. You probably prefer somebody, even machine learning, even AI technology, which help you with information you need. So this is the future. Combine AI technology for assessment, for treatment plan, supporting clinicians with administrative tasks, and supporting also people with monitoring through digital technology. I absolutely finally get in the end of my presentation, and probably just finishing this one anecdote from my time. So government decided to increase price for vodka, and that son is asking that doesn't mean that you will drink less. No, son, you will eat less, but not I'm drinking less. I don't want to waste your time for lunch, and this is why I'm stopping right now. Thank you very much for your attention.
Thank you very much, Eduard. We have one question from Slido that I see. Are social media algorithms a major driver for mental health issues for today's youth? And can AI be used to tackle this issue, or at least make the youth aware of it?
Yes, it's a very important question, because social media is one of the reasons of many mental health problems, because social media has huge power on the young people, on how they're feeling, how they just assessing themselves, how they perceive themselves. And social media is also a very good promoter in the future, which may promote understanding about mental health, which may help to destigmatize mental health people, because people with mental health issues, they scared us. They think in psychiatrists are very, very, just dangerous or very strange people. You would prefer to meet somebody, but not psychiatrists. Actually, we also stigmatize. So I think social media will do very good job if it's run in the right way.
Thank you very much, Eduard.
Thank you.